Laurie, Cyr-Martel.
Hi, welcome. So I was told I have, and I'm not a good stander, so I might be shifting because Dan doesn't want to move the camera. So I'm standing here.
I can follow you.
So it has been a journey, and I thought about putting together a PowerPoint slideshow for your entertainment purposes, but when I was thinking about this, it really has been a journey. So that's literally what I'm going to present to you today, kind of my journey of why USM, why the SBS, and where it's really gotten me, so to speak, from its almost infancy stages. I did start out as a firefighter paramedic years ago. I know it's been 30 years, but I actually started when I was 10. And went to California actually, and that's where I studied and became a paramedic, but moved back to New England because at the time I finished the paramedic program, the burnout rate was 6 months. So I didn't really relish the thought of going through all that training only to know that in 6 months I probably wouldn't want to do the career that I loved. So I moved back to New England, was hired in the state of Maine, and worked as a paramedic here for several years. And then I found myself more drawn to the psychological trauma of things than the physical trauma. I would think that most paramedics would share that after several years, waking up at 2 o'clock in the morning and carrying 300-pound people down 3 flights of stairs with an IV bag in your mouth, trying to keep a cardiac level going the way it needs to, rhythm, so that we didn't lose the patient, can become quite old quite fast. So I knew that I needed to expand my horizons, but what was I to do with a background in just a paramedic? Now they have bridge programs, so paramedics can become nurses. Back then there was nothing, so that when I got through my paramedic degree and I started applying to nursing homes, I was told, sorry, you don't have a certificate. And I, being the forward person, said, you mean I can't empty a bedpan, but I can put chest tubes in people and intubate? And to which I was told by a director of nursing, that's correct. So I began the search, and at that time, there was a split program, UMA and Southern Maine, and I started taking classes at the college on Western Ave in Auburn. And then this school started to grow and grow, and SBS, when this came about, it just sounded right. It sounded as if it would take my experience, it would take what I had for education and enhance it. And so I was the second graduating class in the SBS program. And there wasn't the options back then in classes and core and navigating through the different processes of what is available that there is now. So it is grown by mountains. So it's great to see where it was and where it has come. When I finished the degree and I went out job seeking, I thought, great, I have a bachelor's in social and behavioral science. And I found that although there were some jobs out there, it wasn't really, I needed more, personally, to satisfy where I wanted to be educationally. I needed more. And so again, I started searching for programs that would take my background, now take the SBS curriculum, look at this and say, aha, how can we enhance that? And that's where I found Antioch, New England, Keene, New Hampshire. And their counseling psychology program just mirrored really the SBS program in regards to where it was and where it was going. And applied and was accepted there. Thank you, Jen Hitchcock, for my letter of reference. When I finished that program and came out, aha, now I have a master's, now I'm going to get the jobs. And so I was very fortunate. I was, during my time going through school, I worked for the state of Maine as a case manager with what was back then, which is now not politically correct to say, but it was the Bureau of Mental Retardation. So that goes back several years. So I was able to keep that job through my academic career, so to speak. And when I came out, instead of going back to the state, I was actually hired at Tri-County doing their crisis program as a crisis counselor, and then went to their clinical coordinator position and worked there for a few years. And then as life changes and luck would have it, I found myself in Alabama, Tuscaloosa, Alabama, near the University of Alabama, wonderful school, and was working down there for a year with high-risk kids, a population I never thought I would find myself in, because my passion has always been for emergency systems, whether it be EMS, fire, or police, and understanding their psychological makeup and understanding how they are able to endure what they endure and still work and focus and move through life day to day. So I did find myself in this position of working with children. And when I say high risk, these were the children that were fire setters, these were the children that were gang members, crack babies, children who had been sold, children who had been sexually abused, children who had watched their parents murdered. So it was truly high risk. And I found myself drawn to this population. It was ironic. We would meet every morning, all the therapists, and Monday mornings, and all these new cases we would review. And each therapist would say, oh, I want to work with all the depressed kids, or I want to work with all the ADHD kids. And being the newcomer, I didn't have much input, really. I just kind of stood back, and what I found, what was left, were all high-risk kids. And I went, oh, I'll take those. And I got these looks and stares of, okay, well, let's give her a try and see how she can do. But it's a population, I guess the old adrenaline junkie, once an adrenaline junkie, just stays there. So being able to work with these children was great. After a year, moved back to Maine and relocated again, went back to Tri-County, and worked there for a few months till a position with the state opened up. And the position was a joint position with the state of Maine as well as the Lewiston Police Department as their forensic person and their mental health liaison. And so I was duly trained, so they did send me to their reserve academy, and I wore a uniform, except mine said behavioral services on it instead of patrol officer. I'd go through the same training as the officers. Twice a year I'd still have to qualify with all the firearms. But for 40 hours a week, I handled all the behavioral and psychological emergencies. I was fortunate enough to be sent to the FBI training for crisis and negotiations, so I was able to provide some of those services as well with the police department. Probably one of the most wonderful positions I've ever had in my life, and unfortunately the funding for the positions were eliminated. So the positions that were with Augusta PD, Lewiston PD, and Banco PD are now non-existent. I was fortunate enough, though, after that, to be hired by Tri-County Mental Health, once again, as their, there's a theme here, as their manager of crisis programs. And so I've been there for the last several years, managing the mobile outreach team, as well as their crisis stabilization program. The unique piece about this is I'm still able to collaborate with law enforcement and emergency services. I still provide their CIT trainings, which is crisis intervention trainings for law enforcement. So they're able to respond to mental health and behavioral emergencies more adequately, with more awareness and knowledge of how to de-escalate and engage with individuals going through crisis. So 3 years ago, I decided, oh, a master's degree. I need more. And so I started reviewing different programs throughout the country, and when I'd gone to an American Counseling Association conference in San Francisco, I had met with several colleges and universities and narrowed it down to a couple, and ended up applying to Arizona State University in their Doctor of Behavioral Health program. Dr. Cummings, who was the doctor who created the PsyD so many years ago, is also the doctor that created this Doctor of Behavioral Health program. So at this point, I'm hopefully 2 months away from receiving my little piece of paper. We'll see. I'm in what they call, I won't say a bad word, but the data analysis piece is quite challenging. I'll just leave it at that. And but my culminating project is what this program, another name for dissertation, has been with law enforcement, and I looked at stress and resiliency in the police officer as compared to A1C, blood pressure, and productivity. And Auburn Police Department was nice enough and kind enough to allow me to do that research. So I'm not sure where the journey will take me from here, but it's been a heck of a journey, and I still say that without the openness of the behavioral science program and what it allowed me to experience and the classes and the professors that cared enough to challenge me and push me, even though some of them were frustrating at times. It provided that balance and substance that I needed to move along in my career. And then along this journey, so to speak, a few years back, I had written a handbook for police officers on how to respond to emergency systems in the community. And speaking with Jan Hitchcock, she said, have you ever thought about maybe making that into a syllabus in a class and looking at how that would fit with our social behavioral science program? I said, no, but I could certainly give it a whirl. And lo and behold, Response to Community Health Crisis was born. And so one of my favorite, obviously, classes to teach at that time. So God willing, I'll be around for a while, still teaching that class. The other two that I've taught is the Deviance and Social Control and Intro to Social Services, which love those as well. But so as the journey continues on, I hope to still have the colleagues here that I see. And with that, I'll close and open it up to ask questions about the programs or what my thoughts and feelings are about SBS or anything else I might be able to answer.
Yes. Since I have to scoot down for a minute. Have you seen any significant changes of how police and even health professionals respond to people with mental illnesses over the span of the time that you've been working for Tri-Mental and the other places? I have a son who has mental illness, and I'm always interested in how, the people who pick him up when he has a breakdown and just the care people take care of him. I've seen some change. I'm just curious about whether you've seen some change, hopefully for the better, in how people respond to people with mental illnesses over your journey.
Yes, thank you. Most certainly, NAMI, National Alliance of Mentally Ill, was instrumental in bringing the CIT program from Tennessee to the state of Maine back in 2000. It's a 40-hour class. Obviously, it's not intended to make social workers or counselors out of law enforcement, but it thoroughly provides, again, that basis and foundation on how to more appropriately respond. So for me, the aha moment was when I first arrived at the police department, and we all use lingo and verbiage in our day-to-day genres, no matter what that might be. And some of the verbiage that was used was probably less than politically correct. And again, I was there for almost 8 years, and probably 5-6 years after I'd been there, we responded to an individual that was having a very difficult time, and one of the officers looked at me and went, "Laurie, I really think he's decompensated." And I was so taken back because that was not a word that officers used to use. But it has been incredible to see where the state was before CIT arrived on the scene and where they are now. That being said, unfortunately, so much of the funding to do the trainings, even though the training is free, departments still have to consider officer replacement cost. So if you have a small department that only has 3 officers, you take those 3 officers out to send them to training, there's nobody to cover the community. And if you have a larger department, then you're paying overtime. So that still comes into play with considering when and where and how to run CIT. I'm doing another CIT class in April, and it's the first one we've had in 2 years. So we still see the NAMI being able to generate the interest and provide that training with the support of community mental health partners to get the information to emergency systems. And now it's expanded beyond law enforcement, so we have emergency nurses attending, we have security from hospitals attending, EMS attending, so it really has grown exponentially, but definitely have seen a change in the last 15 years.
Laurie, I have 2 questions. One is focused and one's a little more general. The focused one is, I know that you've also been supervising students for internships, or at least your program has. At Tri-County has been a theme in your own career. For people thinking, geez, maybe I want to have Tri-County be a theme in my professional career, what can students get internships there? What advice would you have? The second more general question is, right now someone's interested in some sort of counseling career. what advice would you give current SBS students?
Okay.
Thank you.
So the first question in regards to interning at Tri-County Mental Health. Most individuals look at Tri-County obviously as a training site. And so I will tell you that 3 people that have interned with me were my students, and I did hire them in crisis itself. Now, beyond that, with the SBS degree, especially with the MERT-C component of SBS, case management is open in regards to a field that a person with an SBS degree and the MERT-C can enter and be able to be hired. So interning, yes, it gets your foot in the door. It allows the student to become that known entity, because we would rather hire someone we know who has the skills than someone we've not worked with. So that's always an option. And in regards to the second question regarding counseling and where to go and how to fit in, and there's 2 boards in the state of Maine. One is the LCPC and one is the LCSW. And both boards have different lobbying. And I will tell you the LCSW is much stronger lobbyists than the LCPC. And so right now, even though I'm an LCPC, I will tell you that LCSWs are being scooped up at agencies more readily than the LCPC, only because of reimbursement and billful factors. And I see heads going up and down. And that's unfortunate, because the LCPCs have as much training and knowledge and are able to provide as much as what the LCSWs are, and yet we're seeing that decline. Even though 2 years ago there was parity signed for TRICARE for the veterans, so that LCPCs would be able to provide that care for our military, unfortunately we are still seeing the LCSWs being hired more than the LCPCs. So did that answer?
Well, that was a good critical emerging bit of information. Thank you.
Got any new courses in mind?
I would love a forensic course, just saying.
We would too.
Yes, Carol's been dying to do that.
So that's kind of some type of forensic health.
Can I pigtail with that? Because I'm in a program planning class, so I'd like to know how you go from your knowledge into teaching a course.
It's hard to live up here. No.
So how do you plan your programs? What's your process?
So I'll go back to when Jan and I initially met regarding the response to community mental health crisis, really did an outline. What was the focus of my material? What did I want to be able to provide to the general public in regards to the students' information and education? And so broke it down into, this is what is definitely required, this is what a student really should know facing a community crisis in mental health and how they can go on. And this would be great to know, but not necessarily needed, and this is not needed. So it really was trial and error and doing an outline, going right back to my 6th grade outlines in regards to what it looks like, what I want it to look like, and what it needs to look like. Hope that answered.
Yeah, that's helpful. So you built your program before, because I had been interviewing people for my class, and 2 of the women I interviewed built it as they went, and that doesn't seem like, and even they say it's not a wise choice to do. So it sounds like you built yours before you ever stepped. I mean, you can tweak it once you're there, but you actually had a format, a plan.
Correct.
Place.
So I developed the syllabus, shared it with Jan, who shared it with faculty, and then it went from there. So it was, once I shared it, then obviously it had to be approved, but I didn't come in with it going, I didn't have the syllabus, I had already spent time looking and breaking it down.
Great, thank you.
You bet.
If I could just add to that, once you get the external certifications, every single syllabus is reviewed by those agencies, and sometimes things need to be added to it. I don't think yours had that. It was reviewed, but it was added.
Thank you. What else?
Laurie, could you give us, both students and faculty here, some reflection, some feedback, given the change in law enforcement and responding to mental health in and out of bureaucracies, how could you see the SBS major developing in the future that could more meet those needs and train and educate the kind of students that could work in those fields?
I think one of the crucial steps really was implementing the MERT-C. because that opened up, I think, many doors for the students.
Does everybody know what that is?
MRTC, MHRT MRTC, it's a certification through Muskie that, that allows the student to provide case management. If it's not built into an educational track, then an individual can take the classes needed for MRTC independently, but it costs a lot. There's like 10 classes. So it's great that that's implemented in. In regards to where to go from here as to what the students might need and foresee, I think more around, and I know Rose does a trauma class, specifically children's trauma, children's forensics. You know, what I bring to some of my classes when we're talking about our kiddos and mental health, the individual that ends up having substance abuse issues didn't wake up at 22 and go, yes, I'm going to be a substance abuser. So how did it get from A to B? So for me, more children's applications as well as forensic applications would be my utopia.
I'm from the business community. I work at a local bank, and I'm also a student here. I'm a long-time student that they're trying to graduate. One of these days I will. But being in banking for 27 years, I'm really exposed to a lot of young community members with a lot of anxieties, and you know, a bank is an institution, and just trying to work with my team on how to interact. We're lucky enough to work for a bank that has no minimum balances and a free ATM, so it's a great start for them, and I want to work with them. But I'm finding I'm dealing with a lot of issues that I never did before, and you know, where do you get the resources? You know, how do I help my team? You know, we deal with homeless veterans, and we have regulations that we have to follow, and you know, we try to work with them and try to earn their trust, and we deal with homeless teenagers trying to get started. Again, we're a safe place because we work very closely with our customers, and you know, or just young. I just find so many young ladies are sitting in front of me, just so much anxiety and so many issues. And I say that when you're overdrawn, I'll call you. We'll work it out. I will help them through the steps, but I would love to find a place to have some resources, because my team is. Sometimes we're just like, we don't know how, we're bankers, we don't know how to address those.
Great question, and nor should you. However, there are resources, so I will tell you that we've gone out, and I say we, myself and other members of my team, and provided training on basics to mental health awareness. I've done it for libraries, we've done it for school systems, we've done it for landlords, we've done it for taxi services. There's so many people. Obviously, we interact with everybody. I mean, it's the human race. And being able to be genuine with an individual and provide, I don't have the answers for you, but here's somebody who might. Or if somebody looks like they're in distress or need, these are the numbers you can call, or let me call the crisis team, somebody can come here right now and speak with you. So having that information and awareness of what's out there would be huge, so I'd be willing to give you some numbers afterwards.
Great, or just how to interact when we're feeling that there's some trust issues, and how do we help them through that, some basic things like that too.
And the other piece to that, unfortunately, we've had situations within our community where either, I'll just say, financial institutions have been robbed. And how do those individuals within those financial institutions maintain their health, having gone through that type of stressful situation? And there are people that will respond to that and do debriefings for financial institutions as well. So that's something we can speak about as well.
And I guess maybe related, does everybody know about, so is it NAMI, National Association of NAMI? NAMI?
NAMI.
You want to give everybody a translation of the acronym?
NAMI is the National Alliance for the Mentally Ill.
And Tanya Curry-Bailey, who's a student here and works in the community engagement office, she let my students know about community engagement opportunity that once a week, I think it is, maybe it was once a month, but I almost want.
Once a month.
Was it once a month? That she does she runs an open support group for people, I think at the library, for anyone, doesn't have to be someone that has necessarily diagnosed mental illness, but anybody that wants to come and talk about those issues. I don't know if you do that.
Again, that's another important resource to be able to refer people to, because they do run support, NAMI does run support groups, not only in their main office in Augusta, but throughout the state. So giving them a call and saying what's running. The various churches also have groups up and running, as well as the hospitals have groups up and running. Various mental health agencies have groups up and running. So it's all about knowing what the resources are and how to refer people out. Oh, certainly.
I'm Mary Ann Peabody, and I teach some of the child-oriented courses here. So I want to go back to your comment, which I love. And I've had a couple of guest speakers from Tri-County into my classes, Caitlin Cashman and Rachel Coop, I believe is her name, about very small children, because I'm looking at a couple of students here that have interests in young children. Are there opportunities for internships there as well, focused on, as you said, these kids just don't wake up these adults don't wake up at 18 and are older. Are there a lot of different opportunities, and what would those be as far as internships or community engagement experiences? It's always tricky in a mental health agency to say, yeah, go, because of all the confidentiality. So can you kind of speak?
So, and I can only speak for Tri-County, I know there's other agencies out there. So when an individual applies for an internship with us, once accepted, they have to go through a week-long orientation just like you were hired. So the whole confidentiality piece is gone over, you learn the computer system, so it's just like you were being hired. In regards to the infant mental health, we do have an infant mental health program, as well as a mother-parent, that we work with women in the prison as well, who have children. And so my suggestion would be, if there's students that are interested in doing that, to submit an application for internship to Earl Fournier, who's the HR person, and say, this is what I'm interested in. You can throw me under the bus if you want. And just say, what are the potentials? Can you forward this where it needs to be? And then the managers of those programs look at it and see if they have openings.
I wondered if you could do some crisis intervention at USM.
Yes.
And
Always.
But literally, when an organization is going through crisis, and everybody knows USM is, what are those big pieces, those big button issues that somebody with your experience and your view of the world, Laurie, what advice do you give people when they're going through it?
So when an organization finds itself in a stressful situation, there's several concerns that arise. And organizationally, we look at what's been interrupted, how it's been interrupted, what have the fallout effects been? Is it combined fallout effects? What I mean, do we have staff and colleagues that are on the same page? Do we have individuals that are saying, you know, I'm not saying this is happening, I'm just saying these are some of the traits and characteristics of what happens to organizations, where we see things falling through the cracks, where we see individuals aren't caring for themselves, where we see the camaraderie is no longer there, we see the isolation, so people are working in silos versus together. So when we look at how do we abate that, how do we attend to that, it's really getting people in the same room. And I'm not talking about sitting around a table holding hands and singing We Are the World, that's not what I'm saying. But it really is looking at what can we do from here. It is validating, acknowledging, recognizing what's transpired, what can't be changed, what can be changed, what are the responses emotionally, psychologically, and cognitively to what's going on, and then offering that support around that.
Wow. Could we hire you as soon as you have your doctorate to be a
Please,
full-time prof?
need a job. No.
Well, I was thinking, Laurie, kind of along the same lines, our front end, we have students that we have to deal with and work with that have issues all the time. Would it be beneficial for us downstairs to do a training? And how long is a informational basic training? I mean,
2 to 4 hours, depending on what you want, what you need.
Seems like it would be worth our while to do that. Yeah.
Any other questions? Sure, Betsy.
I was just curious, I'm Betsy, I'm the Alumni Director for USM, and I was curious as to what the need is in terms of for mental health professionals. I just came from another meeting earlier today where someone was talking about like nursing's at the top, and there's huge needs for other types of industry. I'm kind of curious, what are you seeing in terms of needs across the state? And then maybe what's that 5 to 10 year, you know, where do you see happening?
Again, depending on the licensing, I've spoken with colleagues down in Portland, and they're saying, we're flooded. We have so many people that are LCPCs and LCSWs in private practice sitting upon each other, it's crazy. Other colleagues who are renting spaces in different places around Lewiston Auburn area are finding they've got plenty of work. Many of them are going through either Sweetser or health affiliates and doing that affiliate model to access individuals for therapy. It'll be interesting to see what happens with our state government in regards to the funding for things and what might be cut and what might not be cut. And specialties. I think if you are a therapist that specializes in a particular, I will tell you now, there's no one I know of, and I could be talking out of my head, but the one person I knew of that worked solely with juvenile fire setters no longer does that. Person started up a practice with that, they'd be overwhelmed with people because we have a huge problem in the state with kiddos setting fires. Not many people want to work with sex offenders. So I think it depends on where your generality is and where you want to specialize in.
So I heard you, I mean, talking about the southern part of the state, but what are some of the other needs, sort of north of even Lewiston Auburn? Are we finding that there are real needs?
I will tell you that our state is going into integrated care. That is where the nation is headed, is we have to stop looking at just medical alone and mental health alone. We really have to look at the mind, the brain, the body, and spirit connection. If we don't look at that, then yeah, I think you will see things dissipate, kicked off. That's okay, I'll talk loud. So I think we will see things go awry if we don't learn to connect those things. So I do see people being hired throughout the state. It's just beginning in regards to integrated care and putting clinicians inside primary care offices and hospitals. And St. Mary's in Central Maine is taking off with that. So that would be the push, is if you want to be a clinician, to look at integrated care.
It's happening in pediatric offices, as you're saying, the primary medical home where the children are.
Yes, the behavioral health homes, primary medical homes, yes.
I
Carol?
just want to point out also at the bachelor's level, there is a statewide shortage, and it's a big one for MRTs. I'm on the redesign team right now, and they're in short supply. So before we get to graduate school level, our graduates are getting snapped up.
And that emergencies is what? Mental health,
Mental health.
rehabilitation?
Rehabilitation, yes.
Technician?
Yeah.
So I don't know how long that'll go, but at the moment, that is a grant for guaranteeing an initial job.
Yes.
In case of emergency.
Great.
Anything else?
I have one last question, Laurie. I have to ask, back to SBS, where
Yes.
it began. We're struggling to keep our interdisciplinary programs here, and they want them in Portland Gorham, but how can we keep them here? And we're doing it right, but yet, what do you think, how do you think things have evolved for you coming from the SBS that integrates the social psych and anthro with professional preparation? How is that different than, say, if you just had your bachelor's in psych or any of the other social sciences.
It's the well-roundedness, and employers look at that. I just had a young lady come to an interview yesterday. She put her resume in front of me, and after we get done, she goes, "Can you tell me if this resume is good? I just want to ask you." And I was quite honest with her. I mean, it was good. It spoke to what her strengths were. It spoke to her well-roundedness. It spoke to what I look for when somebody comes into crisis, that she does have that understanding of behavioral sciences, of psychology, of what happens and from a socioeconomic perspective when we look at people that go into crisis. So I really think it's the well-roundedness that this program brings that allows its sustainability. That's Laurie's opinion.
Thank you very much.
Well, I'd like to thank Laurie for coming in again. This alumni lecture series, if anything, is just really shown us what